This is the skill administering subcutaneous medications. Complete the medication guidelines, including the 3 checks against the MAR, identifying the patient using 2 forms of identification, and educating the patient about the medications they will receive. Complete the 6 essential tasks. Select the appropriate syringe and needle size. This will depend on the patient size as well as the medication being administered. Draw up the medication. Make sure that this is the correct medication and dosage for the patient, and do not give more than 1 milliliter of the medication in one particular site. Select the appropriate site. For subcutaneous administration, we are working with subcutaneous tissue or fat. So we want to make sure that our site has adequate amount of subcutaneous tissue. Areas we can do this are the outer aspect of the upper arms, abdomen, anterior aspects of the thighs, high on the buttocks near the waist level, or the scapula area near the upper back. Make sure you are rotating sites if they get subcutaneous injections regularly. For heparin, abdomen is the only site that will be used. Position the patient so the injection site is accessible and the patient can relax. Don clean procedural gloves. Clean the injection site with an antiseptic pad by circling from the center of the site outward for alcohol and using a back and forth motion for CHG products. Allow the site to completely dry. Remove the cap of the needle safely. With a non-dominant hand, pinch or pull the skin taut at the injection site. This will depend on the patient's size. If the patient's average size, or when you pinch their skin it is less than 1 inch, inject at a 45-degree angle. If the patient is obese, or when you pinch their skin it is greater than 2 inches, use a 90-degree angle. At this point, you could also use a longer needle as well and spread the skin taut instead of pinching. Hold the syringe between the thumb and the index finger of the dominant hand like a pencil or a dart. Insert the needle at the appropriate angle into the pinched up skin or the taut skin if working with an obese patient. Stabilize the syringe with the fingers of the non-dominant hand. Using the thumb or index finger of the dominant hand, press the plunger slowly to inject the medication. Remove the safety needle smoothly along the line of insertion. Gently blot any blood with a gauze pad. Engage the safety needle device and place in the sharps container. Document administration of the medication and complete the ending 4 tasks.